Hello everyone. Today we're going to talk about breast surgery. As you know, the breast is one of the organs that give beauty to a woman, but there are many diseases that can affect the breast and affect its shape, which necessitate the need to result breast surgery in some cases. Breast surgery is a procedure that modifies women's breasts. There are different types of breast surgery that will be discussed in this video. During this video, we'll explain to you everything related to breast surgery, its types, the reason for resulting to it, as well as some possible complications. Our role today is to answer most of your questions regarding breast surgery. Today we have Dr. Kwon, who is a leading doctor at JK Plastic Surgery. He is going to discuss with us everything about breast surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you will be updated with our new releases.
안녕하세요.
안녕하세요. Hello, Dr. Kwon. So can you introduce yourself to us?
I'm Director Won Soon-hong, who is in charge of breast and body plastic surgery at JK Plastic Surgery. Currently, I worked at JK Plastic Surgery for about 11 years, but before that, I worked as a 4-year resident at a university hospital and has been in charge of plastic surgery for the next 11 years from that day.
So what do you think is the most important factors when you perform breast surgery?
Patients want a full-bosomed and natural-looking breast. The most important thing when performing the surgery is to understand the shape of the breast that the patient wants, and the doctor explains what type of breast can be implemented through surgery to patients. It is important to align the direction of the surgery for both. Everyone has a breast in the shape they want, but it is not always possible to make it the way they want. Therefore, it is important for doctors to fully explain to the patients and let them understand what is the best shape of the breast that meets the patient's current body conditions. Of course, for those who want a voluminous breast, to make the breast voluminous even at the expense of other factors, and for those who want a natural, pretty shaped breast, it is important to make a natural breast even if the breast is not made full-bosomed. Therefore, it is important for doctors to meet the patient's needs as much as possible.
Okay, so how much incision does breast augmentation cost, and how long does the scar last?
Basically, there are 3 ways to perform breast plastic surgery. The first is a lower part breast incision method. The second is the areola incision method. And the last is the armpit incision method. Each method has advantages and disadvantages, so it cannot be said that a specific method is always good. From a global trend, breast surgery is often performed with the lower part breast incision method. However, in Korea, many patients refuse this method because of the possibility of scars around their breasts. So most people wanted the armpit incision method. Looking at the data over the past few years, foreign patients often wanted a breast underlying incision surgery rather than an armpit incision surgery. Therefore, I propose breast underlying incision surgery to foreign patients first. And if they don't want it, I recommend an armpit incision surgery. All incision methods require a large implant to be placed in the breast, so an incision of at least 3 to 3.5 centimeters is required. When performing an armpit incision, an endoscope is used, so a 4-centimeter incision is required. Patients think that it is difficult to cover the surgical wound when undergoing an incision surgery. However, even if the lower part of the breast is incised, a new shape of breast is formed above the incision to cover the incision. Therefore, when viewed from the front of the breast, the wound is not noticeable. In the case of areola incision method, the scar is naturally covered because the incision is made accurately along the boundary between the areola and the skin. In the case of armpit incision, the wound can be covered perfectly, since there are natural wrinkles on the armpit. So the incision is made in a form similar to that of the wrinkle to minimize the scar from being noticeable.
Okay, so when can the patient start physical activities again after the surgery?
We can divide implant insertion into 2 locations during breast surgery. Based on the breast muscles, implants can be placed above or below the muscles. The criteria for determining the location depends on how much fat the patient currently has in her body and how much breast tissue she has. If there's enough fat and tissue in the body, even if an implant is placed above the muscles, the implant shape is significantly covered by the patient's breast, forming a natural breast shape. However, skinny patients, especially Asian women, often have a small breast. so we should put the implant as deep as possible to make it look natural. Therefore, in this case, a prosthesis is placed under the breast muscle. In order to insert an implant under the breast muscle, a part of the breast muscle must be incised. Therefore, when performing surgery in this way, arm and breast exercises should be avoided for the first 1 to 2 weeks. Still, after about a month, most exercises such as golf, swimming, yoga, Pilates are possible. On the other hand, surgery to put an implant above the muscles does not touch the muscles. So immediately after surgery, pain hardly occurs and exercise restrictions are not significant. So 1 to 2 weeks after surgery, all exercises are possible.
So do you have any memorable or special cases in these years of being a plastic surgeon?
I remember all the patients who had breast surgery with me. In particular, there is one person who visited the hospital last week after undergoing surgery 2 to 3 months ago. This patient underwent breast plastic surgery at another hospital around 10 years ago. After the surgery, the breast was slightly asymmetric, but she recently visited our hospital because one breast was getting bigger. Before coming to our hospital, she visited several other hospitals for counseling, but other hospitals told her that she had a breast problem and had to do the surgery again. It was a major surgery to reduce one enlarged breast and raise the sagging breast. However, in my opinion, what the patient wanted was not to complete the breast through surgery, but to eliminate the discomfort caused by breast asymmetry and to create a natural breast. So I performed a simple surgery to change the implant so that it could be a natural breast without performing a major surgery. The patient also liked the method I recommended and operated at our hospital. 2 months later, when she visited the hospital again, her breast was not as elastic as a young person, but a natural breast shape suitable for her age was formed, and the inconvenience previously caused by asymmetry was resolved. There were few scars left, and the patient was very satisfied because she was able to make the desired breast with simple surgery. This is a case that can explain the point that is important to understand and match what the patients want before surgery, which I mentioned at first.
So lastly, can you tell us what's the difference between breast lift and breast reduction?
Breast lift and breast reduction surgery are surgeries that change the breast itself, unlike breast enlargement. Breast lift surgery does not aim to remove the breast volume, but rather to move the breast fat elsewhere. Therefore, the purpose is to reduce the amount of breast fat removed and to lift the shape of the breast. Breast reduction surgery is to raise the leaned area, and the goal is to reduce breast fat as much as you want to remove fat. Therefore, it has the advantage of reducing breast size a lot. In both methods, the appearance after surgery is almost the same, and the scars are similar. But the post-operative recovery period is different because the surgical process is very different. Naturally, breast reduction surgery, which removes a lot of tissue, requires a longer recovery time.
So are there any age limit for breast surgery?
People who are too young cannot undergo breast surgery. Basically, the age of use of prosthesis used for breast augmentation surgery has been set at the age of 22 or older in Korea and the US FDA. It is not illegal for women under the age of 22 to undergo surgery, but recommendations are over the age of 22. It is not because the body was less developed before the age of 22, but because it is usually considered to have a clear right to decide what they truly want after age 22. And there is no maximum age limit for surgery. Instead, when a very thin person among older people wants to undergo surgery to enlarge the breast, they recommend a way to make the breast look naturally large or suggest inserting a smaller implant. Alternatively, it is recommended to perform surgery that reduces the burden on the body, such as proposing a fat transplant instead of implanting a prosthesis. There is no particular age limit other than that.
So that's it for today. Thank you so much, Dr. Kwon. 감사합니다.
Thank you.
So today we learned many things about breast surgery, and the doctor explained in details everything related to this surgical procedure, such as its types and how it can be done, as well as some possible complications. Thank you for joining us today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as we can.